Good evening, folks. This evening's topic D, and the last one for the night is metabolic dysfunction. Okay? Now, that affects the brain also. So, we're going to go through all of it in the presentation I made for you. Sit back and enjoy, please. Okay, metabolic dysfunction, especially insulin resistance and related hormonal changes, is increasingly linked to brain structure changes and persistent memory cognitive problems in bipolar disorder. Targeting metabolic health is a promising clinical pathway. Hook up with a concise finding. Metabolic health predicts gray matter loss and memory problems in bipolar disorder. Mechanisms, evidence, and clinical implications. Give me 1 second, folks. Practical steps and resources. Key evidence and talking points. Insulin resistance and leptin dysregulation are associated with worse cognition in bipolar disorder and collate with reduced gray matter volume in key brain regions. Studies show metabolic dysfunction is more strongly linked to cognitive defects in bipolar disorder than in major depressive disorder. Real world inpatient data find insulin resistance relates to longer illness duration, more hospitalizations, and greater polypharmacy. Multidisciplinary care and lifestyle interventions, nutrition, exercise are recommended. Emerging pharmacological options, e.g., GLP-1, are under investigation but need careful integration. Suggested guests and why clinical researcher who led the biological psychiatry study, or a co-author to explain imaging and biomarker links. Psychiatrists with metabolic focused practice to discuss screening and medication choices. Endocrinologist or diabetes specialist to explain insulin resistance and brain effects. Person with lived experience. Ground the science in daily life. What metabolic markers were most predictive of memory problems? How might repeated mood episodes drive metabolic change and neural progression? What routine metabolic screening should psychiatrists adopt now? Are there safe evidence-based metabolic treatments that improve cognition in BD? Yes. Treating the body may protect the brain. Metabolic health is part of psychiatry care. Insulin is a traffic cop for brain signals. (15 to 30-second lived experience). Encourage listeners to ask clinicians about metabolic screening, BMI, fasting, glucose, HOR or HOMAIR, lipids, and lifestyle support. Risks, limitations, and how to frame them. Casualty is not proven. Many studies are cross-sectional. Longitudinal work is needed. Avoid overpromising treatments. Emerging therapies, GLP-1s, ketogenic approaches show potential but require more trials and careful psychiatric coordination. The 2024 network meta-analysis makes one conclusion impossible to ignore. Antipsychotics as a class exerts a markedly heavier metabolic burden than mood. Stabilizers with agents such as olanzapine, risperidone, and imisopride consistently emerging as the most disruptive to glucose regulation, lipid profiles, and weight While mood stabilizers generally occupy the lower risk end of the spectrum, a deeper look at the study, this analysis synthesized 41 randomized controlled trials involving 11,678 participants, allowing researchers to compare 17 different antipsychotics and mood stabilizers across 12 metabolic endpoints. The breadth of outcomes: fasting glucose, insulin, HbA1c, total cholesterol, LDL, HDL, triglycerides, weight, BMI, waist circumference, prolactin, and bilirubin created a panoramic view of how these medications reshape metabolic psychology. What emerged was a clear heredity. Antipsychotics consistently outperformed mood stabilizers in producing metabolic harm, often within weeks. Olanzapine, repeatedly ranked at the top for worsening cholesterol, triglycerides, and LDL. Risperidone showed the strongest association with elevated fasting glucose and insulin. Amisulpride produced the greatest weight gain across trials. Mood stabilizers were not metabolically neutral, but their overall impact was significantly milder, and in several domains they were indistinguishable from placebo. What this means for clinical practice: the findings sharpen a long-standing clinical tension. The medications most effective for acute mania and psychosis often carry the steepest metabolic cost for individuals with bipolar disorder, already at elevated risk for cardiometabolic disease. This creates a delicate balancing act. efficacy must be weighed against metabolic vulnerability, especially in patients with obesity, insulin resistance, PCOS, or family history of diabetes. Routine metabolic monitoring is non negotiable. Baseline labs early follow up. After medication changes and ongoing surveillance can catch problems before they escalate. Shared decision making becomes essential. Patients should understand not only symptom control benefits, but also the metabolic trade offs of each agent. Practical monitoring and management, a multidisciplinary approach, psychiatry, primary care, endocrinology, nutrition, and pharmacy creates the strongest safety net. Establish baseline metabolic data, weight, BMI, waist circumference, blood pressure, fasting glucose, HbAc, HbA1c testing, lipids. Reassesses 4 to 12 weeks after initiating or switching antipsychotics, then every 6 to 12 months. Integrate lifestyle interventions early, structured nutrition supports, physical activity programs, sleep optimization can meaningfully blunt medication related metabolic shifts. When abnormalities emerge, coordinate care rather than shifting responsibility. Psychiatric and metabolic management must move in parallel. Limitations and further directions. The meta analysis highlights important gaps. Most trials were short duration, leaving long term metabolic trajectories uncertain. Subgroup differences. By sex, age, bipolar subtype appeared repeatedly, but required targeted research. targeted research. The field still lacks head to head long term RCT comparing metabolic outcomes across modern antipsychotics. Still, the message is clear. Metabolic stewardship is now a core component of bipolar disorder treatment, not an optional add-on. Okay, guys, so that's your last one for the night. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.